before 50, which is where the metabolism, say, of things like hydantoin come through. If you have a defect in metabolizing hydantoin or dilantin, and then you're taking dilantin, the combination of the two is what actually leads to the risk for birth defect. The same way, through that same pathway, you have many of the same chemicals. So it's just bringing together what is the exposome with what is the genomic work. So I think that there are a number of opportunities in this area, looking at how do we address a prevention before pregnancy begins, and also take into advantage of all the new technologies. I was mentioning the machines that now can do sequencing in 2 hours. They can do something similar for multiple exposures in exposome. So it is a combination of the genome and exposome that could be key. So in summary, prevention of birth defects is a reality, and preconceptional care could be and should be a target to address potential pregnancy risk. And the paradigm shift here is the time to think about pregnancy is before it begins. Thank you.
Thank you, Dr. Cordero.
Thank you, Dr. Cordero, for this review of the problem of the paradigm of how to prevent congenital malformations before the pregnancy. Well, the next speaker is Domenica Taruscio. Domenica Taruscio is currently the director of the National Center for Rare Disease in the Instituto Superior de Salud in Italy. He is a member, independent expert of the European Commission Group of Rare Diseases. And also, he was one of the previous president of the ICOR conference. She's a leader of several European projects, but I would like to highlight three of them. One is advocacy to help to develop national plans and strategies at the member states, which can be translated to other members, other nationalities and other countries. And the second is EpiRare. EpiRare is how the registry of rare disease should be implemented. And the third, which is now ongoing, is the rare best practices, which is how to develop guidelines with a good quality in a rare disease, which is an innovative field. Domenica.
Thank you very much, Manuel, for this nice presentation. I would like to thank Professor Cordero because he will facilitate, of course, my presentation as we discussed before. And I would like, I don't have a conflict of interest, although I forgot to put it in the slide, but I will add if we circulate the slides. I do not have a conflict of interest at all. I'm not a genius, let's say, that of course I'm the director of the National Center for Rare Diseases, so that means that I can coordinate several teams and we can develop several items. So I'm coming from Rome, and this is just to give you, some. You are welcome. So I hope that I can invite you back. I thank you for this invitation, and I hope that you will come to Rome too. We are very active in organizing also many workshops and courses. So I will speak about the European recommendations. We call it European because they have been approved by the European Commission, but of course they can be applied to other countries. Hopefully we can continue updating this information and we can collaborate also with Professor Cordero and others in order to update this information. So I would like to thank many colleagues which are involved in this collaboration, and it's nice because we can continue the discussion that started Professor Cordero. Primary prevention of congenital anomalies is recommendable, feasible and achievable. And why, in this context, in rare disease meeting in ICORD, we are speaking about congenital anomalies. Many congenital anomalies are rare. So there is a 30% overlapping between congenital anomalies and rare diseases. Of course, not all congenital anomalies are rare, following the definition USA and European prevalence, but many of them are rare. So this is our business too. And for us, it's very important to study the prevention of congenital anomalies, also to open the discussion of the primary prevention on rare diseases. So, this is a joint achievement between two different efforts. And why I'm I'm presenting this? Because I really believe in collaborations, transnational collaborations, international collaboration, all collaborations between projects, institutions, and so on. This is a very fruitful collaboration between Eurocat and Europlan. Europlan has been mentioned by my friend MAnuel Posada, and is a project started in 2008, funded by the European Commission. But let's start from Eurocat. Eurocat is a huge network of congenital surveillance, congenital registries, many registries that perform not only surveillance, they are active also on other fields on congenital anomalies. This is the website, and you can really go there and you see the richness of this network. Europlan, as MAnuel anticipated, is a project that has been funded by the European Commission in 2008 and is coordinated by us, is continuing. And our aim was to elaborate, to prepare tools, capacity building, but also tools, material tools, let's say, recommendations, indicators, together also with Manuel Posada and other colleagues, of course, in order to facilitate, to prepare the framework and then facilitate the elaboration and the adoption and implementation of national plans. So a general, let's say, framework in order to take actions on rare diseases, not just a point, but a general framework. And this project has been very important because it is quoted even in the Council recommendations, and of course we are proud of it. So now, before starting, we knew it that in Europe this was a European project, so a European collaboration, so it's mainly concentrated in state of art. We started to see which kind of policies and actions were existing in each member state regarding primary prevention of congenital anomalies. So we studied several topics, folic acid supplementation and fortification. I should say that in Europe, only Ireland adopted until a certain time the fortification. Now all European member states, thanks also to a joint activity between the European Food Safety Agency, the EFSA, and also our institute was very active in this, but also of course the agencies of other countries. We are now, all European countries adopting the supplementation with educational and so on. So we studied also the maternal lifestyle, conditions, use of drugs, genetic factors, and exposures to therogenic agents. I would like to speed up because otherwise the topic is very large, so, but just to give you the basic information that we did not review just the literature in order to write these recommendations. We based our recommendations on facts. So we performed 2 questionnaires. One, we collect the policies on folic acid, so to protect factors that protect protective factors or folates, and we received the answers here. the answers in 22 European countries. And the second, we collected information and policies related to risk factors. So, primary prevention, as brilliantly said Professor Cordero, is related to prevent the disease. So you can act in reducing the risk factors, or you can act also increasing the risk that protect the fetus. All this information are published and available on the Eurocat, on many other sites, but also on the European Commission website, but mainly on Eurocat website, because this is really an important piece of work. So it's a special record on primary prevention in the European countries. This is the status. Then we starting from these results, we elaborate recommendations on policies to be considered, so that means that are not mandatory, to be considered for the primary prevention of congenital anomalies in national plans or strategies on rare diseases. As you may know, in Europe there is a big commitment at European level as well as at member states level to have a national plan on each member state. Actually, many member states, I will show you, have now a national plan dedicated to rare diseases. But the topic of primary prevention was not included in the areas, priority areas of the national plans. Why? For ethical issues, because primary prevention sometimes is confused with termination of the pregnancy and so on and so on. So, for practical, this is, let's say, one of the reasons. I don't know why, but the Council of the Ministries cancelled primary prevention from the priority areas of the recommendation. So then we started and we said, okay, I would like, evidence-based. So we collected the information through the literature, we collected the information through these two surveys, and we elaborated these recommendations. And of course, we would like really to advise countries that this recommendation should be integrated in within a framework, within a plan, not just as a single action. So we tackled the field, the recommendations are in the field of medicinal drugs, food, nutrition, but also lifestyle, health services, and pollution, environmental pollution.